On the Healthline Nevis News and Reviews Roundup, brought to you courtesy of the Health Promotion Unit in association with Evelyn's Drugstore. Hello and welcome to this week's edition of On the Healthline News, Reviews and Updates, a bi-weekly health news package courtesy of the Health Promotion Unit. I'm your host, Sheila James. In this week's edition, in developing news on the Perinatal Information System SIP, Health Promotion hosts provider initiated testing and counselling training PICT, and SKM moves Nevis chapter almost 3 years on as Jamaica launches Jamaica Moves. We'll have more on these stories after this short break.
Nevis is safe. Nevis is ready to welcome the old, the young, and the very young like me. We are doing our best so you can enjoy your rest. The sun, sea, and sand of our beautiful shores awaits you.
Welcome back. In developing news, senior staff from the Ministry of Health, Community Nursing and Maternity met recently with PAHO consultant Dr. Jessica Prince, who conducted a debrief with the Permanent Secretary in the Ministry of Health and Gender Affairs, Ms. Shalisa Martin-Clark. The Perinatal Information System SIP is an integral part of sustaining the elimination of mother-to-child transmission of HIV and syphilis in St. Kitts and Nevis. Additionally, SIP collects other health data on the expectant mother and child to monitor their progress during their pregnancy and delivery. Here we have Miss Nadine Carty-Keynes, who gave a review introduction prior to the debrief session.
SIP was first introduced as a paper-based system with the development of the electronic SIP software specifically for Caribbean countries. St. Kitts and Nevis took the opportunity and implemented this electronic system in 2017. As part of the Pan American Health Organization, PAHO, WHO, which is the World Health Organization biennial work plan for St. Kitts and Nevis, in collaboration with Latin American Center for Perinatology, CLAP, has been working with the in-country team for several weeks to transition from the electronic-based SIP to the web-based SIP+. The information technology representatives, Mr. Craig Davis and Mr. Jaron Brown, dialogue with the team from CLAP to transfer and convert the SIP data for Nevis to SIP Plus version 2.3.0. This version can be accessed in real time and used to update client information using a client code that is specific to the client.
Following the implementation of the electronic database conversion to web-based data, training was offered to all healthcare professionals at all health centres, including doctors and nurses at the Alexandra Hospital, who are directly involved in the provision of care during pregnancy and delivery. PAHO consultant Dr. Jessica Prince was tasked to undertake the training. Here we have more on this report with Dr. Prince.
One of the main parts of the program was training all of the nurses and midwives on how to use the new and updated SIP Plus system, and they have all been adept in learning the system. They all receive hands-on training on how to pull up a patient's file and type in data and putting information into the system. So all of the health centers in Nevis are now equipped with a fully functional perinatal information system that is online and computerized and fully digitized. During my time at the Alexandra Hospital, I met Nurse Andre, and I was very impressed with what they have done so far. They were able to have all of the births recorded into the perinatal information system for Nevis up till the year 2022. And I also trained some of the midwives there and met some of the midwives, and everybody's up to date on how to use the system. Hopefully in the future we'll be able to eliminate the need to use paper perinatal cards, and we will have the system completely digitized. Additionally, besides training them on using the SIP program to input basic maternal data. I also train them on how to use it to record information on mothers who may have COVID-19 or may have been in contact with anybody with COVID-19. So any pregnant woman presenting with any respiratory illness that would be of public health concern would be in this perinatal information system, and wherever they would seek care within the Nevis health system, the receiving person, the admitting person will be able to get all of the information on the computer. So I can confidently say that the project has been a complete success, and I believe that Nevis will be one of the islands in the Caribbean that will be leading the way forward in SIP.
Permanent Secretary in the Ministry of Health, Ms. Shalisa Martin-Clark, in closing, shared her gratitude with Dr. Prince and her counterparts.
We are making strides here as it relates to maternal care here in Nevis. I take this opportunity to personally thank you, Dr. Jessica Prince, for accepting the task and for working with our doctors and nurses at the Alexandra Hospital and the community health centers in training them in the use of this new system. Kindly convey our thanks to your counterparts in the PAHO office in Barbados. Thank you once again.
You're welcome.
And in other news, Health Promotion Hosts provider-initiated testing and counselling training PICT on the 21st and 22nd of September 2022. The Health Promotion Unit, sponsored by the Ministry of Health, hosted a provider-initiated testing and counselling for healthcare providers, specifically around HIV and AIDS testing. Teresa Herbert, Education and Prevention Officer from the Health Promotion Unit, spoke with On the Healthline about the purpose of the training.
The purpose of the training is to ensure that our healthcare providers can provide HIV testing and counseling that is both empathetic and science-based. Most importantly, we want the general public to know that our services offered are completely confidential. The training, which I felt was highly successful, included healthcare practitioners from different parts of the Ministry of Health.
On the Healthline met with two practitioners from the Alexandra Hospital who shared their experience in attending the PICT training.
My name is Dr. Farrell. I'm a doctor here at the Alexandra Hospital at the outpatient department.
My name is Dion Flanders. I'm a staff nurse at the Alexandra Hospital. I attended the provider initiative for HIV testing and counseling, and it was very informative for me.
The workshop to me was very important because it allowed us to know that it's very important to give counseling before and after the HIV test, because it's not only important just to know your status, but you also have to know methods of reducing your risk.
One of the things that I've learned, if your result comes back positive, there are treatment available such as counseling, medication, and also you can exercise so that you can live a more healthy and longer productive life.
The training was facilitated by two veteran nurses, Lorraine Archibald and nurse Eldina Farrell, who both successfully used tools to further enhance the knowledge base and encourage good practice in relation to HIV and AIDS testing. In closing, Ms. Herbert spoke about the expectations following the PIC training.
So as we strive to combat HIV and AIDS in our federation, it is important that we have healthcare workers who are equipped and knowledgeable and able to deliver quality care to our patients. It is equally important that our patients feel confident in entrusting us with their care.
After the break, our focal point presentation. SKM Moves Nevis chapter almost 3 years on as Caribbean Moves launches in Jamaica.
Hi, miss, are you okay?
I'm chest hurting me, pain gone down to me.
Someone call the ambulance.
Good day, you've reached the Alexandra emergency line. This is Nurse Hanley speaking. What is your emergency?
Someone is experiencing severe chest pains. Please send an ambulance immediately.
Please stay on the line. I need to collect some information in order to help you. If you can stay on the line, What is your number? I can call you back.
I can stay on the line.
Where is the ambulance needed?
At the top of Princess Street opposite the Glade store in Charlestown. Please hurry.
Okay, the ambulance will be dispatched shortly.
Welcome back. In October 2019, SKN Moves Nevis chapter was launched. Almost 3.5 years later, the SKN Moves in Nevis has grown in stature. In 2019, the Half Island Walk Relay was formulated. In 2020, the introduction of the 2-mile bike relay. And in 2022, 3 more events were added to the SKN Moves Nevis chapter calendar. Events, the movement has grown and is successful. We owe to all our participants, the hard-working committee members. NIA have been with the movement from its inception. However, working in partnerships is part of the engine that drives the events. In this latest report, we take in the onset of Jamaica as they recently launched Jamaica Moves. We would like to wish them every success as they carry their mantle to better health in the Caribbean. Here is Nadine Carty-Keynes, coordinator for the Health Promotion Unit, who was one of many who participated in the launch of Jamaica Moves.
Hello, I am Nadine Carty-Keynes. I am the coordinator at the Health Promotion Unit in the Ministry of Health and Gender Affairs. I would have attended the Regional Health Communication Network meeting in Jamaica. It's an annual meeting, and that would have been on the 13th and 14th of September. Now, the Caribbean Regional Health Communication Network is comprised of communication and promotion officers from member states within CAFA. This was established in 2015 as a means of all communication and promotional officers within member states to come together to share ideas, share strategies for us to improve the delivery of health information to our various populations. At the meeting in Jamaica, we would have discussed topics such as COVID-19 hesitancy among the member states. We would have spoken about infodemic and the impact on COVID-19 vaccination strategies. And we would have discussed different strategies to mitigate those infodemic information, how we can plan and strategize to improve our communication network, especially in the face of COVID-19. We also discussed monkeypox and our preventative measures that we are undertaking here in the region and getting information out as an extension from COVID-19. So then to close out the event, we were invited to be part of Caribbean Moves, and we know we have SKM Moves already established. Caribbean Move evolved from the Jamaica Moves, and so St. Kitts and Nevis, Trinidad and Tobago, and Barbados are 3 of the islands that would have already started their moves. St. Lucia would have recently launched theirs. So in Jamaica, we were invited to Emancipation Park, where we met the Honorable Christopher Tufton, the Minister of Health in Jamaica, and other team members of the Jamaica Ministry of Health. We also had delegation from CAFA, and of course we had the Caribbean Development Bank, which is one of the major sponsors for Caribbean Moves. And so we had other partnership members that were there to show their support for Caribbean Moves. And so we had a grand time at the launch at Emancipation Park, and you can see some highlights from some of the clips that will be shared. So at the end of it, we're just trying to get persons to move in the region, and we just invite everybody to be part of whether it's SKN Move, Caribbean Moves, whomever moves, just move.
1, 2, 3, put your hands together, and let it go. I now declare officially, Caribbean Moves has been launched.
What Caribbean Moves is about. It really is about having fun, enjoying your culture, enjoying your history, enjoying your identity, whether it is roti and curry or izaki and saltfish, but do it in moderation.
We view it as a complementing wider effort to strengthen health systems to improve quality of life for citizens across the region.
We in Caribbean, we have a lot of fun, and sometimes we forget to do the little exercise and cut back on the salts, the sugars and the fats, right? Part of the culture.
The timing of the commencement of Caribbean Moves provides member states with yet another platform to strengthen health and increase the momentum of ongoing national programs for prevention and control of NCDs.
We love our culture, we love our food, we love our socialization, but if we overindulge in certain things, it's going to lead to another challenge.
Caribbean Moves will provide a gender-responsive, culturally appropriate and inclusive framework for promoting physical activity and healthy eating through innovative, exciting and supportive programs where people live, work, study and play.
And so I want to say to Caribbean people, this is one movement for the Caribbean, for all of us, in the interest of all of us. And I really hope it grows and expands and not just becomes an event, but becomes a part of the new culture and the new dispensation. And remember to move.
We have now come to the end of this edition of On the Healthline news, reviews and updates. Until the next time, thank you for watching. Goodbye. On the Healthline Nevis News and Reviews Roundup, brought to you courtesy of the Health Promotion Unit in association with Evelyn's Drugstore.